Hello, I'm Deborah McQuaid. I'm a clinical psychologist and features editor for Clinical Psychology Forum. Welcome to our podcast. I'm here today to talk to Dr. Megan Thurston, a trainee clinical psychologist who's wrote a fascinating paper called Identifying Psychological Needs in Children and Adolescents with Autism Spectrum Disorder and Gender Dysphoria. Megan wrote this paper with her colleagues, Dr. Millward and Dr. Barrett. I had the pleasure of talking to Megan on the telephone last week. We had a great conversation about many aspects of her paper, which I've included here for you today. First of all, Megan told us a little bit about herself.
I'm a third year clinical psychologist trainee from the University of Leicester. And the paper is about a piece of work I did during my child placement in my second year, working with, as I say, an individual with gender dysphoria and autism spectrum disorder. And I've had a long-standing interest in gender dysphoria. And when I started my child placement, it was recognized that I had this special interest. And so when a case presented, they referred the case to me.
As with a lot of clinical psychology, we can sometimes get bogged down in specialist terminology. And I asked her if she could give us a rundown on some of the specialist terminology and what that might mean.
I think I agree. There's a lot of specialist terminology, and in particular when working with individuals with gender dysphoria. And as you say, some of it can be quite confusing, and we're not familiar with it. And I think there's some really useful glossaries available online. So, for example, the Gender Identity Research and Education Society has a useful list of terms. And also, the American Psychological Association has produced a definition of terms which are available online. So, I have included some of these terms in the article. So, for example, I refer to the process of transitioning. And this refers to changes that an individual makes in order to live as their preferred gender identity. So it can include document changes, so changing their name or identification documents, appearance or social role. I also use the term natal, um, which refers to the sex assigned at birth. So I think I refer in the paper to natal male, natal female. And I also use the term gender dysphoria. And gender dysphoria is the diagnostic label. So the diagnostic label specifically in the DSM. Um, and gender dysphoria refers to the distress experienced between an individual's gender identity and the sex they were assigned at birth. So those are some of the terms that I've used in the paper. But as I say, there's the glossaries available online that have a much more comprehensive list of terms and definitions. And I think it's also just important to mention, I guess, and something that comes out in the article, that when working with individuals with gender dysphoria, it's really useful to respect and use their preferred names and pronouns. So when they're transitioning, they may have chosen a more female or male name, and also the pronouns that are associated with that. And I think working with this case example and my work in gender dysphoria, that's a really important point to consider as well.
I went on to say that one of the things that Megan mentions is that the young person James talked about in the paper was extremely well versed regarding gender and the transitioning process. As someone who works in adult mental health, I found this fascinating, and I was interested as to where young people are getting their information from. I wondered if there is good quality information readily available online, for example, for anyone who might want to find out more.
James was very good on the computer, so he was quite able to find information. So, for example, he'd accessed pro transgender websites such as Mermaids, which is specifically for young people and children. And by accessing this support, he also used that to educate family members, peers, and school staff about relevant issues. And as we've mentioned previously, the specific vocab that's used in gender. James and his mum also visited support groups in the local area where acceptance was really a strong key message. and it was quite empowering for him, and it helped normalize the situation. So there are, as you say, there's information that I've provided in the paper about recommendations to support people with gender dysphoria, and in particular children and young people. But there is quite a lot of information available on the internet. When you look through the information on the internet, I guess there's some pieces of information that are linked to support groups such as Mermaids, or things like the American Psychological Association, or GIRAs, or something like that. And there's also information, and I guess it's weighing up the quality of it. Yeah, definitely.
Megan went on to tell us about her clinical management of the case.
James and his family have been on such a long and difficult journey, I guess, with both regards to the diagnosis of ASD and gender identity concerns. And these have also been accompanied with symptoms of low mood, anxiety, distress, and there's a lot of social stigma and emotional difficulties that accompany transition. And that was part of management of the case. So it's really important to assess James and his support system with an open mind, and work collaboratively with him to develop a unique psychological formulation, and also reformulate as new ideas and perspectives came about during the sessions. So, in particular, support regarding James's emotional well-being and risk management were a real significant part of the intervention. And as well as individual work with James's mum was important for her to model and reinforce techniques that were discussed in the session. And as I've mentioned, school were also informed regarding recommendations to support James with his transition when he went back to school. I think it's important to notice, because James also had a diagnosis of ASD, techniques and I guess interventions that were used were also adapted. So, for example, I moderated language. I tended to use concrete examples of connections between thoughts, feelings, and behaviors, and also shorter sessions, because James had difficulties regulating emotion. So yeah, that formed the basis of the intervention.
In the paper, there are a few references to risk. I asked Megan to tell us a little bit more about risk in this particular client group.
So yeah, as mentioned, risk was something that was constantly monitored during sessions with James. So at the minute, the evidence suggests that individuals with ASD experience higher rates of low mood and anxiety, and rates of attempted suicide are higher in individuals with gender dysphoria. So it was really important during the sessions to make sure that this was monitored throughout. It was also important as well to educate parents and carers and school how to monitor risk and ensure the safety of James was maintained during the support we were giving him.
Finally, I asked Megan to talk about the good practice guidelines that she refers to in the paper and how helpful it would be to have these. It wasn't clear to me if these good practice guidelines exist at this point in time.
So, to my knowledge, there's no good practice guidelines for how to assess or recommended interventions specifically for working with children and young people in this area. So there's quite, as you said, there's a growing area of research and clinical practice, and I guess a document will never be a one shoe fits all, but further guidance on what the research indicates, what professionals need to explore, would be useful. And I guess specifically for the case example in this paper, guidance regarding how this relates to children and young people, and also children and young people with ASD, would be particularly useful for clinicians.
Thank you, Megan, for speaking to me about your paper. So just to remind you that identifying psychological needs in children and adolescents with autism spectrum disorder and gender dysphoria is in this month's special issue of Clinical Psychology Forum on gender. I hope this podcast has stimulated you to go and find out more about what's in that issue and to read this paper for yourselves.